and go ahead.
Thank you, Kia. So good morning. Welcome to the second public hearing on our demonstration 1115 family planning waiver. This session is being recorded. My name is Beth Tinker. I am a clinical nurse consultant at the HCA, and some of my esteemed colleagues are here as well. So we are recording the webinar, as I already said. Attendees are muted. If you have any questions or comments, please use the chat feature, or you can raise your hand and verbalize any questions. We will be capturing questions both in note-taking, just to be sure that we've got it all, and we will also have the recording. We plan to post this recording at the link on the HCA website that is indicated here. Currently, the current draft waiver application is also posted in that location. So that's another opportunity to review much more detailed information and give us any comments or feedback. So this is the agenda for today. I do think this will be much shorter than an hour, but we will take as much time as we need. So I'll give a quick intro of myself, family planning program overview, a little bit around the waiver extension application overview, and then open it up to any questions or comments. So my name is Beth Tinker. I already said I'm a clinical nurse consultant here at the Healthcare Authority. This work has typically been covered by a family planning program manager. Christine Kenyatta held that position for a couple of years, and she has moved on to other opportunities in just this month in July. And so I am working to catch up and cover this work until we get another person kind of in the role. So just so folks are aware. Okay, so I'm going to go over. So there are two different programs that are a part of the family planning only waiver demonstration. One is the family planning only pregnancy related program. That is for clients who have recently been pregnant and whose Apple Health coverage typically ended 60 days post-delivery. This context has changed with after pregnancy coverage, which is our 12 months of postpartum coverage implemented last month in June. And I will say a little bit more about this. We are retaining the family planning only pregnancy related program in the waiver, because as long as the PHE, the Federal Public Health Emergency, is ongoing, we do have some but limited need for this program, the family planning only pregnancy related. The second arm of the family planning only program in the demonstration waiver is the family planning only. This is the former take charge program, which we still use that language sometimes because it's familiar to a lot of folks and provides some context to what we're talking about with the family planning only program. This program really serves uninsured individuals who have contraceptive needs, or otherwise said they are seeking to prevent unintended pregnancy, teens and domestic violence or IPV victims who need confidential family planning services are another population that are eligible for this family planning only coverage. What are the goals of the family planning only program? Improve access to family planning and family planning related services, to decrease unintended pregnancies, to lengthen intervals between pregnancies and births, to improve positive birth and health outcomes. There's substantial evidence that greater intervals and planned intervals between pregnancies do predict better outcomes, both for birth parent and for infant. And of course, with any federal demonstration waiver, there's a requirement around cost neutrality. So this is kind of this last bullet here, to reduce state and federal Medicaid expenditures. In this context, really what we are looking at and what we capture in those quarterly budget neutrality reports for the waiver are the cost offsets from pregnancy, the prevention of pregnancies, and what those costs would have been predicted to be if there had been a pregnancy. So what are the benefits and coverage under the family planning only waiver programs? These are all included. These are for both arms of the waiver program. So that's both the family planning only pregnancy related and then the family planning only. comprehensive family planning preventive visit, that's once every 365 days. Counseling, education, initiation and ongoing management of the chosen preferred contraceptive method of the client, cervical cancer screening for aligning with federal guidelines, STI and STD screening and testing and treatment, prescription and non-prescription contraceptives. All of the FDA approved contraceptive methods are covered in these programs. Sterilization procedures for folks of any gender. So we're talking about vasectomies and tubal ligations, and then HPV vaccinations, which are a more recent added benefit to the family planning only programs. So what are the eligibility guidelines for the family planning only waiver programs? You have to be a Washington resident, have intent to live and stay in Washington. The income requirements for the family planning only programs is the 260% of the FPL. You must not be eligible for other full scope or more comprehensive Apple Health coverage and not have other health coverage. That is not the case for folks who qualify under the need for confidential services. Just to be clear on that. Oh, sorry, that's the last bullet. Services are also available to folks who are seeking confidential services. So this slide has some of the kind of high-level overview of where we are with the family planning only waiver extension. The current demonstrations, these are 5-year demonstration waivers. So the current waiver, the demonstration period it continues until June 30th of next calendar year, so June 30th of 2023. We intend to apply to extend for another 5 years. So the demonstration period for that future, that next 5-year period would be through June of 2028. Our renewal application is due to CMS by the last day of September. We actually asked for an extension on that. Originally, it was June 30th that our waiver renewal would be due, but we asked and have approval to extend that due date to CMS for the waiver renewal application until September 30th. The purpose, client eligibility requirements, and benefit package will remain the same. The asterisk there is to indicate this piece around and we've already talked to CMS about this in our regular meetings with them, that when the federal PHE is declared over, we intend then to move towards eliminating the family planning only pregnancy related program, as we will no longer need that program. It will become obsolete when the PHE is over, as all clients then should roll onto the 1 year of comprehensive Medicaid Apple Health coverage in Washington, which again is called APC, or after pregnancy coverage. The public comment period has been extended. Originally, it was to go through today, or it might have been tomorrow, might have been July 30th, but regardless, we've now extended it through another month. So through August 26th is the public comment period. So again, we have additional time. Thank you to our partners and advocates for asking for this. The reason for this is after the public hearing, the information was not posted, or it was posted and then somehow what we know is it was not available as we had intended it to be. And certainly the purpose of a public comment period is for folks to be able to read, digest the materials and react to them, and to give us comments to really improve our renewal application. So we are pleased to, hopefully that is enough time for folks. Again, on our end, what we are trying to meet is that September 30th deadline to get the renewal application in. So I believe this is, yep, okay. So now any comments that folks want to either type in the chat or ask verbally, other opportunities to prevent any public comments. Again, the public comment period is ongoing and extends through 5 o'clock on August 26th. So we can also just email any comments or feedback to the email inbox there, the family planning at HCA. We will capture all comments and our response to them. We will use them to improve our application. We will also include any comments and our response to them as an appendices in our renewal application to CMS. So just to be really clear about how we will be using that information and kind of where it will go. So with that, my email address, feel free to email me directly, or the family planning inbox, which we monitor. That's probably preferable, just so we can make sure that we're tracking everything. But if there's a related question or something, perhaps not specific feedback on the renewal, please feel free to email me and I will get back to you. And I think that's it for my planned content. So and if there's anything in the chat already, and I think maybe there is. Perfect. Thanks, Leslie. I see your chat. I think maybe colleagues at HCA, just so I mean, I know we're still recording, just probably for another minute or so if Leslie doesn't have any other comments. Anything I forgot that you feel like is important that we want to capture on the recording?
Not that I can think of.
I don't believe there's anything either.
Okay, thank you both. Okay, then Kia, I think we can go ahead and stop the recording.
All right, I'm stopping the recording.